Hello everyone, Couche, and welcome to the first ever Partners in Health Sierra Leone audio update. I am John Lasher, the Executive Director of Partners in Health Sierra Leone, and if you're listening to this, you're probably also a staff member of Partners in Health Sierra Leone. In our first episode, we have an exciting announcement. The excuse for us to have this audio update in the first place. And to make that announcement, I'll be joined by Dr. Gerald Young, the District Medical Officer from Kono. And then finally, YouTube celebrity, frequent PIH Sierra Leone name dropper in videos highlighting mental health care in Kissy, stigma, and videos helping us understand some of the reasons countries like Sierra Leone are poor in the first place. John Green will be here in the studio. We don't have a studio. I made that up. We just have this microphone and a computer. That's what we have. John Green supports Liverpool Football Club. I am sorry to all of the Tottenham, Arsenal, Man U, and Man City fans out there. He writes novels, and we hope soon he will be a return visitor to Sierra Leone. So I wanted to launch this audio update for a long time to reach out directly to you, our unwavering, indefatigable, inspiring, dedicated, passionate, Ebola fighting, health system strengthening, MDR-TB program creating, National Psychiatric Teaching Hospital unchaining, incredible PIH Sierra Leone staff members. And audio also may not reach everyone, but I figure it can't hurt. We should have more than email and staff meetings to update the team on our successes, challenges, upcoming opportunities. As well, this will become a good way to share news about PIH's global work. And I plan on regularly inviting members of our team to share on this platform, on this audio update, to share about their work. I know we need a Creole version.
I'm Shadia.
Shadia what?
I'm Shadia Conte.
What's your job with PIH?
I'm working as a finance officer in PIH. I'm liking it. I think this is a great idea, but my concern is why don't you do this audio update in Creole so the least or layman can understand what your message will be?
Is this a way to let everyone know that my Creole is really bad after 5 years?
It's not like that. You've been trying, but you're not too good in Creole.
Hey! That's true.
But you're too excellently great in English as well. So for the layman to understand your English, you need some help with someone that can actually translate your English into Creole. Rather, just do the audio Creole. We can understand you a bit, but not everybody can actually.
All right. Thank you, Shadia.
You're welcome. Nice doing this.
Thank you.
Yeah, you can do this. Thank you.
How do you say thank you in Kono? What? Shadia, you don't know how to say thank you in Kono?
I don't. I don't.
You heard it here first, everyone.
Do you know how to say it in Ghana?
Yeah, of course I do. And you know what I could do? I can ask someone and then edit it in that I said thank you in Kono. I know how to say good morning and good afternoon, but I'm not going to do that here. It's embarrassing.
I know. Let's forget it.
Okay. Thank you.
Thank you.
All right, let's get to the actual announcement. And to join me to make this announcement, I have the dogs at Mudge Farm barking in the background. They're excited. I'm excited. This is the whole reason we created the audio update for this very moment right now. So as part of our overall strategy to reduce maternal mortality in Sierra Leone, PIH is going to fight as hard as possible with the Ministry of Health to mobilize the resources required to expand Koidu Government Hospital's campus and build a center of maternal excellence, or as we have been calling it, a maternal center of excellence. The idea behind the Maternal Center of Excellence is to expand access to care for women and children in Kono District and introduce new clinical services that don't exist currently at the hospital. In addition to that, though, and importantly, we're going to introduce training in collaboration with the Ministry of Health so that there are credentialed programs to train future generations of doctors, nurses, midwives from Sierra Leone and also across West Africa. We want to partner with PIH Liberia, the Liberian government. We want to also partner with the University of Global Health Equity in Rwanda to have student exchanges. There are so many things we can do leveraging the power of Partners in Health and our academic partners to make sure that in the epicenter of maternal death in the world, we have the leading center of excellence. And it is not just about the building. The building is but one piece, a required piece, but one piece of a strategy to reduce maternal mortality. We still need our CHW program. We still need to invest deeply into government clinics. The Maternal Center of Excellence, though, is a key piece of this strategy. And we're proposing to build this center of excellence. The planning for this is going to require our experts from across PIH, from across different PIH sites. It is going to require deep collaboration with the Ministry of Health, and it's going to require friends and partners from around the world to help us realize this dream. And we're very lucky that we have such committed friends around the world that want to see Sierra Leone become a safer place for women. And they believe, just like I do, that our team is the right team to get this done with the Ministry of Health. We all know PIH is excited about this and the Ministry of Health is excited about this, but rather than have me tell you that the Ministry of Health is excited about this, I wanted to go directly to Dr. Gerald Young, the leading Ministry of Health official in Kono District. Good morning, Dr. Young.
Good morning to you.
District Medical Officer. What should I refer to you as, Dr. Young or District Medical Officer Young?
Well, Dr. Young or District Medical Officer Young, they are synonymous. Anyone will suffice.
Okay, I want to make sure I'm following the right protocol. You're the lead Ministry of Health official for Kono District in the far east of Sierra Leone, and you've been partnering with PIH, and you're PIH's main Ministry of Health partner here in Kono District.
Which is true, and of course is not only a partner, but a very potent and vital partner in Kono. And we all know that PIH has played a very important role in boosting the health outcomes of the people in Kono District by supporting the secondary and to an extent the primary, which is now in full gear. And at the moment, we are very pleased with the cooperation and coordination by PIH. And we all know, in Kono and the ministry at large, about the important role PIH has played in the health delivery in Sierra Leone, and now they are an example of health delivery partner wherein other districts come to copy the good examples and the successes of PIH. PIH has played a very important role in trying to reduce the maternal mortality in Sierra Leone. And by coming up with the idea of creating a maternity center of excellence in Kono, I think and I hope that that will help in not only training Sierra Leoneans, but even nationals from the sub-region. And if we have that opportunity to have specialists that will mentor Sierra Leoneans, train Sierra Leoneans, and we have affiliations with other training institutions all over the world, I think Sierra Leone and Kono in particular will have the opportunity to improve on our capacity and human resource to deliver proper health with the advent of the Maternity Center of Excellence.
Thanks, Dr. Young. So it sounds like the time for the Maternal Center of Excellence is now.
It's really now, and I want it to commence immediately. We do hope that with this cooperation, we'll all speak with one voice and we'll be a team. And when we talk about team, we mean that we have to support each other, love each other, and there should be that aspect of collective responsibility. And in fact, we all know that due to the present state of economy in the country, we know that the government cannot do it alone. But with partners like PIH, I know one day we'll get there when Sierra Leone will be the light of the world or of the sub-region.
It's a high five.
Yes. Thank you very much. One thing I admire about PIH is that when we ask them about sustainability plan, you just hear them say there is no sustainability plan because they don't have any intention to leave. They are here to stay. And if they are here to stay, then we know that we are not only partners, but we are one family.
Thank you so much, Diamo.
You're most welcome.
Hey, John, how are you?
I'm good. How are you?
I'm doing well. I don't know if you can hear me okay, but I've got all sorts of gadgets around my computer.
You sound great. It's amazing that we can have a conversation of this quality across not just the geographical gap, but also the rest of the gaps.
So John Green is now joining us for the first episode of PIH Sierra Leone's audio updates. And John, I've lost count of how many podcasts you and your brother host and you host alone, but maybe you could help us figure out what we actually call this thing. I've asked you to come on this first episode because you and Sarah recently came to Sierra Leone and had an opportunity to meet some of the amazing team members like Dr. Byler Berry and Gladys, the nurse midwife at Wellbody Clinic, Isata and Mark Dumboya, who share a last name and a passion for social justice, but they're not actually related. I'm just wondering if you could share some reflections about your trip to Sierra Leone.
It was a really special week for us, and we were so grateful to everyone who took time away from their work to share with us what they do, introduce us a little bit to the work that they're doing, and it was, you know, this is something that we felt strongly about for a long time. Like, you know, Sarah and I have been supporting PIH in various ways for almost 10 years now. But it's very different to be in a community and see the challenges and see the really overwhelming commitment and passion of the people who are doing the work every day, from community health workers like Ruth, who we met, to Dr. Berry. There were so many people who really just, inspired us.
And what, you said you've been supporting PIH for 10 years. What drew you to PIH 10 years ago?
Well, Partners in Health has long had a reputation for being effective in challenging circumstances and for being able not just to go to places where there needs to be better healthcare options for people living in poverty, but to stay in those places, to make house calls, to go to people, to refuse to accept what we hear all the time from global health authorities, that this isn't possible or that isn't possible. You know, and that's what really drew us to Partners in Health initially, was the belief that there should be a preferential healthcare option for the poor, and that we do not need to live in a world where that does not exist.
Really taken to Sierra Leone, and I'd love to hear a little bit, and I think our staff would really love to hear a little bit about how that came to be.
I never have a good answer for that. You know, I think one of the reasons why why we really want to support the healthcare system in Sierra Leone is because it's so fragile and because we see so much potential, because we're so moved by the work that's being done, even with extraordinarily limited resources. And then I think, the people that we know there, the people that we've met there are just awesome. I don't know what else to say. Like, who knows why I ended up in Indianapolis, of all places, which is where I live in the United States. Like, I don't really know that there's a reason necessarily why I live here, except that I do sort of believe. I come from a Christian background, and I do believe that that sometimes in life you're called to one place or another, or to one kind of work or another, and this is, I guess, what I feel called to.
For us to make the commitment, I think, is the important thing, and we can prove what's possible in a place like Sierra Leone, which has been kind of devoid of investment and long-term commitments for a really long time. So to be able to see the transformation of what is possible in a health system with consistent commitment, and really commitment that is not bound by a contract. It's sort of it's sort of a marriage in a way, but one that we will not end in divorce. That's for sure. But
yeah, well, I mean, I remember when we were in Sierra Leone, we talked with you and Dr. Barry about the idea of making an open-ended commitment and how difficult and scary that can be. But we want to make an open-ended commitment to the healthcare system in Sierra Leone because we feel like we saw over and over again, and I know you see it every day. I know people who work at PIH see it every day. You see people come and leave. You see people come and make big promises and build nice buildings and then leave. And it's so frustrating because very little gets accomplished by, showing up, making a big show of the fact that you're there, and then leaving. And I think with good reason, people have become, that makes people suspicious of aid organizations because it happens a lot. And, we don't want to do that. And we want to be very, very thoughtful and careful that when we're making that open-ended, long-term commitment to support the healthcare system in Sierra Leone, that we stand by that commitment.
Amen to that. And that's, I think, when we first arrived as an organization 5 years ago, this is actually the month that marks our 5-year anniversary here as an organization. The government of Sierra Leone and the people of Sierra Leone are very used to aid coming in and then leaving. And so there was a lot of skepticism about the types of things we were saying, which were, we don't have an exit strategy and we plan to be here for the long term. And I understand why. You only have to drive a short ways outside of Freetown to see signboards that are announcing projects that either never got finished or never even started.
Right.
You're working hard to build a community of people, and you've built a community of people who are concerned about social justice issues. And you've had that community take part in making a positive change in the world for a decade. Can you speak a little bit about and introduce your community? I think you call them nerd fighters. Can you introduce them to our team in Sierra Leone?
Yeah, so for the last 13 years, my brother and Hank and I have been making YouTube videos back and forth to each other. We started this way back at the beginning of 2007 as a way of trying to get closer to each other as brothers. But over the years that we've been making these videos, a large audience has grown up around them. So that now our videos often get over 100,000 or over 200,000 views. And that community of people, they call themselves nerd fighters. I don't know how widespread the word nerd is in Sierra Leonean English, but it's like a word for like kind of a dorky person or a more kind of intellectual person, I guess. And the idea is that we like fight for nerds and celebrate nerdiness and nerd culture. But also our community is oriented around trying to fight for a more just and equitable social order. And as part of that, we've done a lot of projects over the years with lots of different organizations. We have a big annual fundraiser called the Project for Awesome. But in the last few years, we've been thinking a lot more about how to have a deeper relationship, I guess, with the work that we're trying to support. Because sometimes the physical distance between people who live in rich countries like the United States and people who live in impoverished communities, but also the other kinds of distance, can feel so large that it's hard to follow the work closely. And as the people listening to this know far better than I do, long-term problems require long-term solutions. And people love a story that has a simple beginning and middle and end. They love a story where there's one problem and there's one way to fix it, and we do the thing to fix it, and then the problem is fixed forever. That's a great story, but we all know that that's not how healthcare systems get stronger, and that's not how we reduce maternal and child mortality. Those long-term problems, those long-term crises require long-term systemic intervention. And so we're taking our community and we're asking them to donate money, but we're also asking them to follow this story over time, to watch as the healthcare system gets stronger, to watch as there are more people who are able to be employed by the healthcare system, more people who are able to be served by it. And by following that over the long term, hopefully we can make the case that this kind of long-term thinking about how to address the biggest problems that are faced by people is the right kind of thinking, instead of this short-term, simple fix thinking that just doesn't work as well.
And so I'm really, really excited that we are going to be announcing this program to radically reduce maternal mortality in the epicenter of maternal mortality in the world. And I can't think of a better place to build a maternal center of excellence as part of this strategy than in the center of maternal death in the world.
There are no excuses. We do not have to live in a world where 1 in 17 women in any community is at risk of dying in pregnancy or in childbirth. We just do not have to live in that world, and there is no excuse. And so I think, by making that case in a place where it's difficult to make it, and where people are doing really extraordinary work with really limited resources, I think hopefully the message will reverberate out from Sierra Leone to the rest of the world that this can change.
I'd love to have you back from time to time as we develop this audio update, and we'll figure out what it becomes. The purpose of this particular episode was to let our staff know about our partnership with you and your brother and the rest of your family and your community. Our plans to make this long-term commitment to radically reduce maternal mortality, and we'd love to document our progress in doing that, and have you back from time to time, anyone else from your community, to update you on how we're doing, to both bring attention to what we're doing here and answer any questions you or your community might have, and also to introduce you and your community to, to our work here and our staff here.
Yeah, and thank you as well. Thanks to everybody at PIH Sierra Leone again for welcoming us and for doing the great work that you're doing. We, in turn, also look forward to hearing from you. One of the things that I think will make this project work best is having that open exchange and that open flow of information, those open conversations that we can have, across these gaps, so that we can pay the kind of sustained, ongoing attention to these challenges and to the successes as well. so that we can all kind of learn together and grow together, and over the next several years become closer in our work together. So I am really excited. This is just the beginning, the very, very beginning. But we are always happy and excited to hear from you. I've actually seen a few PIH Sierra Leone employees in comments of the YouTube videos, the one from the Kissy Psychiatric Hospital, but also the recent one that I made about the history of Sierra Leone and its impoverishment. And that's always such a joy, but there are lots of other ways to be in touch with us as well, whether it's email, however works for you. We're always really happy to hear from you, and thank you again.
Great. Well, thank you so much, John, for your time, for your commitment to PIH and the people of Sierra Leone.
Here's to the future. All right, take care, John.
Bye.
Bye.
All right, that brings us to the end of our very first episode of PIH Sierra Leone's audio updates. I could not be more excited to announce the Maternal Center of Excellence, the project that we will be fighting hard for every last resource to make sure that PIH and the Ministry of Health can reduce maternal mortality as quickly as possible in Sierra Leone. Thank you to John Green, Hank Green, their family for helping make this possible for us and their participation in this audio update. Thank you to Dr. Young for welcoming us to Kono District and making our work possible. Thank you to Shadia for being a part of this very first episode. And most especially, thank you to all of you, our staff at PIH Sierra Leone, for everything you do every day. The episode is done. All things done. The theme music is from Josephine and the Sierra Leone Psychiatric Teaching Hospital Choir. See you in 2 weeks.